Hi, it's Clemmy from the NARM Clinic, and in this week's video I'm going to be covering the extra symptoms that we can get with inflammatory bowel disease that are outside the gut. Now, this is a topic that came up in clinic last week with a client, so I wanted to cover it because I see online as well that there's not very much clarity about it. So, the fancy name for these extra symptoms are extraintestinal manifestations of IBD. But for the purpose of not tripping over my words during this, I'm just going to call them extra symptoms. So what are the extra symptoms and who experiences them? So as I said, when we have IBD, we have lots of symptoms in our gut, but we can also get other symptoms that we experience outside that as well. And in fact, actually around 43% of people with Crohn's disease experience them and 31% of people with ulcerative colitis. And interestingly as well, more women, so 50%, experience these compared to men at 34%. Now, although these extra symptoms seem to occur more frequently in Crohn's disease compared to ulcerative colitis, actually the location of the Crohn's disease doesn't seem to influence your risk of getting these extra symptoms, whereas in ulcerative colitis, more of these symptoms seem to occur more frequently in pancolitis, so that's inflammation of the entire colon, when compared to ulcerative proctitis, so that's just ulceration of the rectum only. And the research shows us that most people with these extra intestinal symptoms only seem to have one type, so around 63% have one type and about 27% have two types. Now, these extra symptoms can occur at any time, and a quarter of people actually experience them up to 2 years before their diagnosis of inflammatory bowel disease. And for the other 3/4 of people who experience these symptoms, the data shows that they can begin anywhere from between 29 to 183 months. So that's around 2.5 to 15 years after diagnosis. But I'm also sure that there's many people who experience these symptoms before and after this time period too, because as we know, everyone with IBD is different in terms of what they experience. So why do we get these extra symptoms in IBD? The truth is we don't really know, but there are some different hypotheses, different reasons that have been proposed. Now these include expansion of the inflammatory response from the bowel to other parts of the body through certain different mechanisms. Or another one is independent inflammatory events in themselves, and these can be caused by changes in immune function, changes in our gut microbiota, so the microbes that live within us, and also with those changes becomes more increased intestinal permeability. So in other words, in kind of layman's terms, leaky gut. Also genetic susceptibility as well to these other symptoms, or also environmental factors, so things like diet and smoking. Another hypothesis is the knock-on effects of damage to the lining of the intestine, which can actually prevent absorption of nutrients from food, and that can lead to things like osteoporosis or anemia. And a fourth one is actually side effects of the IBD treatment, so side effects from medication. And it's thought that it may be one or any number of a combination of these things that come together to cause these extra symptoms that people experience in IBD. So what are the most common ones? So first of all, joint issues are really common. So around 30% of people will have joint issues, so arthritis type issues. And although we kind of think and associate arthritis with older people, it can actually affect younger people with IBD and can cause pain and swelling around our joints. Now there's different types of arthritis and different ranges of how much they impact people and where they impact people. But the good news is that arthritis in IBD usually improves as the IBD is treated and the condition improves as well. Another thing that is affected is the skin. So skin issues are actually the second most common extra symptom in IBD and affects around 20% of people. And this can range from mouth ulcers to psoriasis. And again, these usually improve as the disease is brought under control. And actually some skin disorders can have side effects, can be the side effects of some medication. For example, things like adalimumab and infliximab can cause a psoriasis type rash. And for me personally, with my ulcerative colitis, skin issues has been the thing that I've noticed most. So I get eczema and psoriasis type things, and I also suffered with rosacea for a bit. Now the next one is eyes. So around 10% of people with IBD experience extra symptoms with their eyes. Most of these are treatable and don't pose a great risk to sight, so that's a good thing. The next one is anemia. So anemia is really common in IBD and can be caused by low iron, B12 and folate, and it's often caused by poor absorption of these nutrients in the intestine, and in the case of iron, actually from blood loss from bleeding in the intestines as well. And the last one I wanted to mention is bones. So reduced bone density, called namely osteopenia, but also osteoporosis, are also very common in IBD and affect around 30 to 60% of people. And this can happen because of long-term steroid use, but also long-term active disease and vitamin D deficiency as well. There are other symptoms that people get. Things with the liver and the kidney are also issues, but I think there's lots of other symptoms that people experience it, and I'd love to hear what your experience are. So please comment and let me know. So how are they treated? As I've mentioned, as we've gone through, a lot of them do improve as the disease improves, and are quite associated with how active the disease is at the time. But others can be a bit more independent and might need specific treatment on their own. Anyway, I hope that was helpful, and we'll see you again soon.